Hey everybody, so I just wanted to make this video updating you guys on what's been going on. I was a little hesitant to kind of say what specialty I was going to because I wasn't sure if I would be able to match into it, just because, you know, it can be such a competitive process. So I officially matched into plastic surgery, which I am very, very excited about. I actually had not even considered plastic surgery until my third year of medical school. I had honestly kind of dismissed the specialty because I didn't know everything that they do. And during my general surgery rotation, I was given a 2-week elective on plastic surgery. And I worked with a plastic surgeon who was just such a phenomenal surgeon, just knew the anatomy so well, just good surgical technique, and the variety of procedures that he did, the impact that he was able to have on patients' lives was just all so great. And I honestly enjoyed it, you know, like, you can help people in medicine in any field, you know, it's not like there's one field that's going to be more helpful than the other, but it's also nice if you're able to enjoy it too. So it's a 2-for-1. So I really, really just loved plastic surgery, and I didn't expect to like it. So I was a little late in the game. There are people who end up being later. So I'm lucky that I was able to, by chance, end up on that rotation. Otherwise, I don't know if I would have gone into plastic surgery. So I just hope that I can, through this channel now, talk about the things that I love about plastic surgery, talk about the things that they do, hopefully do little tutorials, talk more about the program that I'm at. I just need to figure out all the HIPAA stuff that goes along with it and just make sure my program doesn't, you know, I don't want to get fired from my first full-on job, so that would be nice. So I'm just going to double check with all that. Anyone who's going to surgery, best thing you can do is get sutures and do lots of knot tying, tie, practice suturing, know the basics, learning all the bajillion tools that they use and how the names vary between institutions is a challenge, but you just figure out the way that they call it at your program. It's been awesome. So far, I've kind of started. I'm not on my plastic surgery rotation yet. The way that plastic surgery programs work is that the integrated ones, which is what I'm doing, which means that it's a 6-year program instead of going through general surgery first and then applying for a plastic surgery fellowship, I'm just doing 6 years of plastic surgery. So the way it works is that I will still do some general surgery in the first 3 years of my training. Now, how much you do of general surgery kind of varies between the institutions. This one that I'm at, I will do about 8 months this year, and then about 4 or 5 months my second year, and then it'll decrease. I'll have to actually recheck those numbers, but the point is that it's not full 3 years of general surgery, which I do think that there is benefit in learning things about general surgery. There are some parts of general surgery that might not be as relevant as others, but there are definitely, you know, there's overlap. The one thing about plastic surgery that I like is that there's just so much variety, and with that variety means that there's a lot of overlap with other specialties. No clue what I want to really subspecialize in. I'm going to be interested to see what I end up doing within plastic surgery and focus on that. If I go off of what I feel right now, I would say pediatric hand, but seriously, it's all up in the air. I found out about plastic surgery so late, I don't know, you know, what I might end up with. So it's nice to, you know, that there's so much variety and that I have so much to choose from, and that there is very little in plastic surgery that I don't love. So whatever I end up doing, I think I'll be happy with it. And hopefully I'm going to look through for things that I like in my program, things that I've heard from other people that they like about their plastic surgery programs, and hopefully come up with a list of things that you should look for when you're applying. I know when I was applying, there were things that I looked for, you know, how much general surgery do you have? What is the fit with the attendings? What are the cases like? Are you getting enough of the cases that you're particularly interested in? And also, do you have a very broad variety of plastic surgery, because you don't want to have a deficit in any of the aspects that plastic surgery covers. So if there are more specific things that I've learned, because it's different when you're an applicant versus when you're actually learning and actually in the residency. So I will hopefully try and make something about that. If there are any other topics you guys want me to cover, please let me know. But I just wanted to let you know that, yeah, I'm now a plastic surgery resident, and I will keep you guys updated on how it goes.